Hello and welcome to the Integrated Rehab and Performance Podcast. My name is Dr. Nick Curtis and I'm running the show here at the Integrated Rehab and Performance Center. So today we're going to be talking about breathing, breath work, and everything that breathing has to do with performance, longevity, pain and injury, and chronic muscle tightness. Right, so today what that kind of means is I'm discussing how breathing really works, what muscles we're supposed to be using to breathe, and why. And then what happens when we fall into certain patterns of breathing that create long-term discomfort, changes, and patterns that lead to more compensation and discomfort, right? And then we can tie that into performance, right? And stability. Typically, what this comes down to is stability in the thorax and the low back. And when we can't produce the proper amounts of stability, we have a couple different issues that arise there that I have talked about in other podcasts as well as some blog articles as well. So I'll mention those as we come across it. But overall, we're going to be talking about what it means to really work on your breathing, what it really means to have appropriate breathing per situation or scenario, and strategies that we can go into to start integrating breathing and stability with movement, right? So that's really important. Okay, so what really is breathing? So what's happening when we breathe? We take over 20,000 breaths in any given day. We want to make sure that as we're breathing, we are getting the right musculature to do the right job. So we're getting motion in the right spots. We're supposed to be getting motion. And instead of creating patterns and compensations and hypertonic muscles that are doing maybe more work than they should be doing. Okay, so more details here. When we breathe in, the diaphragm, the big muscle below the lungs there, starts to contract and actually descend, right? So if you think about it descending down into your guts and your abdomen. As it does that, it creates more space in the pleural space, right, which is where the lungs are sitting in that upper chest cavity. So it pulls it down. Pressure within there helps to pull more stuff down. It creates space in that upper thorax. When it does that, it gives it room for those lungs to expand. Now, the pressure gradient in the lungs, it's kind of in a vacuum there. They just created much more space, which means the pressure in there just went down. Now, we have an atmospheric pressure. When the pressure in the lungs is less than the pressure in the atmosphere, air will flow into the lungs. Now, when we take that space away by letting the diaphragm relax again, it ascends, it comes back up, it takes away space in that upper chest cavity, the lungs start to compress. Then the pressure in the lungs starts to go up, and when it overcomes the pressure of the atmosphere, air is pushed out of our lungs and into the atmosphere. Now, other things that are involved. We have the diaphragm going down and up, helping create and take away space. We also need the rib cage to move along with the diaphragm, right? So, and the lungs. So as the lungs start to expand and the diaphragm descends, we need to make sure that that space is being also given by the rib cage. So the ribs will move anteriorly, they will move upward, right? They will just start to expand, externally rotate. If these aren't moving independently of each other, the ribs maybe are a little bit stuck. There's other patterns we get into where we can kind of get similar motion or create space for the rib cage without getting actual individual movement of each rib, which we would prefer. All right, what this is called is kind of orienting. It's called orienting. So what happens there is we get that rib flare. A lot of times it comes, you can notice it in the lower ribs. When we see people get on the floor and do some certain exercises or even put some weight on their back, maybe for a back squat, we often see this rib flare. And this is where the rib cage is moving as one giant big unit, really, where we're just kind of extending at that low back, and then we're poking our ribs out in front of us and towards the ceiling. Now that is a strategy. It is certainly not the preferred strategy to create space through the rib cage and that upper chest cavity and thorax. Now, other muscles involved are the scalene muscles. These are like little guitar strings that they attach at your neck and onto the clavicle and the first rib. Right, so they'll attach a little bit onto the ribs, the clavicle, and then up at your neck. You can imagine when these muscles contract, they help elevate the rib cage. So you can see how they can be useful in creating space for the lungs to expand. Same thing with like subclavius. We'll move the clavicle, the sternocleidomastoid, which attaches actually at the low side of the skull, will attach down onto the clavicle and the sternum. Again, this can help elevate the rib cage, but it does not create that independent motion or allow for that independent motion at the ribs. And what happens is we fall into a pattern as humans nowadays, that's pretty typical, where we stop using the diaphragm as much and we start using a lot of accessory respiratory muscles like the last three I just mentioned to help create expansion at their rib cage, when in reality we're just moving the rib cage up and down and not using the diaphragm as much. And these smaller muscles, superficial muscles, they're very close to the surface, they tend to get tight. They weren't designed to be doing so much work all the time. So these muscles start to run into a lot of issues when we use them so much. And again, we're taking 20,000 plus breaths any given day, and maybe even for exercising, and we're kicking these muscles on super early, and they're already tight and hypertonic from the chronic usage that we're asking just a ton from them, and they all attach up near that neck as well. So anyone with neck discomfort, upper back pain, chest tightness, things like that, a lot of times these muscles are implicated here. And anytime we start to have some breathing issues as well, where we might literally have trouble breathing, a lot of times these muscles become so tight, they stop even doing their role to elevate the rib cage well, right? So you can see a cascading effect here. Now, how does this relate back into performance? Again, we will typically use these accessory muscles, respiratory muscles, when we are working out, exercising, and working hard, because they will help the diaphragm along in creating more expansion and space in the rib cage. We just don't want them to be used as the primary muscles for doing that. Now, when we're performing, we need the diaphragm to really help create space in that rib cage to get air in, and then to push air out by taking that space away. We also need the diaphragm to create stability when we are moving heavy weights and moving maybe at awkward angles, side to side, anything like that. We need to be able to create stability at that lower thorax. We need to be able to create stability in the low back, and we need to be able to create space for air to come into the lungs. So a very important muscle. When we stop using it, we don't just lose its capability to create space in the rib cage and the thorax for air to come in, but we also lose its ability to help create stability when we're not using it properly. And again, how do we use the diaphragm to create stability? Well, we just use it for its primary role of breathing. So we use breath to create stability by leveraging the diaphragm. Now, I have a few blog articles that discuss this. One is titled "Low Back Pain After Lifting?" ? And then the second one is "My Back Hurts, Now What?" So these two articles you'll find in the blog section of the website, integratedrpc.com. And from there, you'll be able to click into them, and you will see more details about some of these concepts we talked about, especially the aspect of the diaphragm creating stability. Stability in that low back and thorax. Now, I also have a podcast that kind of summarizes and addresses some of these concepts as well. That is Rehab and Performance Podcast number 1, My Thoughts on Low Back Pain. Now, again, that is a part of the Integrated Rehab and Performance Podcast. It is the first in the series regarding rehab and performance. So, again, that is titled Rehab and Performance Podcast 1, My Thoughts on Low Back Pain. It is in between Golf Episode 12 and Golf Episode 13. Okay, so where do we start when we are starting to look at how do we improve our breathing, how do we initiate our awareness of the diaphragm, and how do we start turning off these hypertonic, overactive secondary muscles of respiration in the neck and chest? Well, one place we start is this called hook-lying hamstring bridge. This is up on the YouTube channel, this exercise tutorial. It's very simple, but we need to make sure we're doing it right. So what we do here for this is we start in this hook-lying position. And this is just feet flat, we're laying on our back. Get into a comfortable position and maybe put something underneath or behind your head to make sure that your head isn't hyperextended at the neck, right? You don't want your chin jutting out towards the ceiling too much or anything like that. Just be in a comfortable position where your head and neck can relax. That's a key in this drill and exercise. We need the head and neck to be relaxed. So here in this exercise, laying in this position, all I want you to do is think about breathing in through your nose and out through your mouth very, very slowly and controlled both ways. Okay, from here I want you to kind of press your fingers into the front of your belly and just feel yourself push your fingers out of your belly, your abs, as you breathe in through your nose. So that is kind of enforcing you to feel your diaphragm descending, and you can feel it expanding and creating pressure in the front. After that, we take our hands and we put our hands in our sides, just below our ribs on the sides of your torso, and we're going to do that same thing. as you breathe in through your nose, can you feel the diaphragm descend? Can you feel it going towards your pelvis and then expanding now laterally? And then the last thing you're going to do is place your hands in your low back and towards the sides. And you're going to do the same thing. You're going to breathe in through your nose and see if you can feel your breath, your diaphragm descending, taking up space, creating pressure there. If that pressure can push your fingers out of that low backside. Okay? If you can do that, then you have learned what it feels like to use the diaphragm to descend, take up space. So it's creating space in the lungs and thorax, but it is taking up space in that lower abdomen. And what that does is it creates pressure there. That's where we want that stability that we talked about, while we're creating space for breath to occur up in the rib cage and in the lungs. Okay. So from there, the last thing I was demonstrating in this exercise is just getting a little bit of a lift of your pelvis off the table. Okay, and what that does is that just helps orient our pelvis a little bit back into a neutral position. We want to make sure when we're learning to use this diaphragm to descend, that we're doing it in a position where our pelvis is in neutral and we're kind of integrating that neutral position into our breath work, right? So that's just kind of a bonus. And then again, lastly, we want to make sure that as we're doing this, we have no musculature turned on in this upper chest and neck. We want to make sure everything is quiet there. No distractions, no tightness. Okay, something we can try here now is creating mobility back into our upper back, our thoracic spine, our rib cage, and even our pelvis and hips. If you do this correctly, you might not see the connection there, but anytime we can create more mobility through our breath into our rib cage, we are also going to be benefiting our pelvis and our hips. So this position, same as last time, we're in this hook lying position. I want you to put your hands on the outer side of your ribs. You were going to get into this little bit of a pelvic tilt like we did last time, where we're just dragging our heels towards our butt, but the friction is keeping our feet right there. And then what that does is just kind of peels our tailbone off the ground. That's all we need, just to get that little bit of backwards tuck of the pelvis. Now from here, what we're going to do is breathe in through our nose, out through our mouth. As we breathe in through our nose, I want you to feel the expansion down there at the rib cage. And then as we breathe out through our mouth, I want you to slowly let the air just fall out of your mouth like you're fogging a mirror. After about 8 to 10 seconds, you should feel your obliques starting to kick in, right? So the muscles under where your hands will be start to work a little bit to really close down that space. That's you trying to push every last bit of air out. When you do that, you need the obliques to start closing down that space to help the diaphragm to close down that space to create so much pressure in there that it overcomes atmospheric pressure to get every last bit of air out. I want you to maintain some of that oblique tension that you just created. All right, so when you feel those obliques start to work, I want you to hold it. I want you to think, okay, now I actively want to keep that contraction, maybe a 2 out of 10 from what you were before. Just a slight contraction there. Hold a bit of that tension as you breathe back in through your nose. What this does is this kind of closes the ribs down, and then we use our breath to control our rib cage positioning as that diaphragm ascends back towards the lungs there. And then that forces all our ribs to, they can't just shoot up towards the ceiling into that orientation I talked about earlier. Instead, they have to actually expand. They have to externally rotate a little bit. They can't just tilt the whole thorax back upwards like we all like to do. Okay? And if you do that, if you're someone who likes to do that, you'll notice that in the next exercise we're going to do, where we're going to actively try to make sure that doesn't happen. Right? So in this exercise, all we're doing is we're creating some rib and spine mobility here through our breath, and we are learning how to breathe and use our diaphragm to breathe without just orienting our upper back and our lower back into that extended position, which just shoots our rib cage up towards the ceiling. Nope, those days are over. Okay, so give that a try. I'd say 10 breath cycles of just practicing, feeling the obliques start to turn on, practicing keeping that contraction as we breathe back in through our nose. All right, and give that a shot. Okay, so for this last one, we're doing a dead bug progression. So you've probably seen dead bug, you've heard of dead bug, maybe you've done dead bugs, but I want to make sure we're doing this precisely here, right? So you see this position I'm starting in. I have a little bit of that rib flare that we talked about. You can see my low back is extended off the ground. It's kind of hyper arched here. And then my ribs are shooting up towards the wall. What we want to do is tuck those ribs back down and get that low back flat to the floor. That's going to be our starting position. So here I'm in that anterior tilt. There's a lot of space kind of down there. And then I pull myself back, right? So I'm a little bit forward. we're going to do is there's me pulling myself back. I'm getting that low back nice and flat towards the ground. And as you can see, as I do that, those ribs tuck down underneath just like that. So nice and flat. So those ribs were pointed upwards. Now my low back's flat to the ground. They're tucked. My ribs are tucked down. That's that position we finished in the last drill, where we used our obliques to create some pressure. We held on to that tension to help keep our ribs oriented downward, so that our breath would just expand the ribs in a different way that we haven't done before. Now we're kind of trying to hold on to and maintain that position as we do just a normal dead bug. But there's some rules now. We cannot let these ribs flare towards the ceiling, so we have to keep that control using our obliques as we use the diaphragm to go up and down. We're also going to keep our low back nice and flat towards the ground, so we can't maintain some of these positions just by shooting our low back into extension to help create space for things like external rotation and a bunch of other things that we need. So even if this means that our range of motion stays limited, like you just saw there, right, where I'm going in using my legs in that dead bug position, where normally we might extend the foot towards the wall out in front of us, or maybe even tap the heel to the ground. If you can't make it that far before your low back starts to fly off the ground because you can't control it, or your ribs start to flare, then we don't go that far. We go as far as we can before we are forced into these compensations, right? And we're actively fighting to not let those compensations occur. So wherever that is, and then we just get better and better and better at it, right? And then we do reps of these dead bugs, keeping our low back flat, keeping our pelvis posteriorly tilted, and keeping our ribs tucked until we can achieve a longer, truer dead bug exercise. But now we're not creating compression on that low back, and we're not just orienting our rib cage towards the ceiling, but instead we are integrating a tucked rib cage position, rib cage, thoracic spine mobility, hip mobility, proper breathing mechanics using the diaphragm to descend, create space in the rib cage and thorax, take away space in the abdomen, and pressurize, because that pressurization is what is keeping our low back from flaring into an extended position as we move our extremities around this new trunk and thorax of ours, right? So we went from an hyperextended and flared rib cage, which only really moved in one direction, kind of up and down. Now it's starting to move in all sorts of directions, 360 degrees from our drills that we practiced earlier. We've learned to stabilize using the diaphragm a little bit better. And again, that other podcast episode has more progressions on how to work on that, as well as those blog articles. And we are learning how to now breathe while maintaining these positions. So we're using the diaphragm to create stability, to create space, but also we need to get air in and out, right? So we can't just hold our breath in these positions. We need to be able to maintain some tension as we start to breathe in and out and in and out, and you get things moving in that direction. So again, it's a skill, it's an art, and it's just something we have to practice, and that is part of the training. Now, again, long-term benefits of all this, of getting all this working better again, is that we create more mobility of the rib cage. We take away tension from these hypertonic accessory muscles that are starting to from our new patterns that have taken over. I'm going to get rid of those. And then we are giving ourselves more opportunity to excel by using the diaphragm properly as a stabilizer, as well as the main breathing mechanism. And then we are now hence improving range of motion at the extremities, especially the hips and the shoulders, in complicated ways. But again, just repositioning ourselves into a more neutral position this way will always give us more range of motion at these extremities. It's fantastic. Okay, so this is some of the importance of breath work, and here are just 3 simple drills that we can start to kind of piggyback and start integrating different things into one key core concept, which can be done and demonstrated here at the dead bug, so long as we're doing it properly and we have practiced the 2 drills that we've done before to make sure that we are hitting those points and maintaining those things that we learned. Okay, so thank you for listening to this podcast episode. We hit a lot for you there. Again, this is a video podcast for portions of it, so make sure you're watching those if it's available, and check out the YouTube video version of it if that's easier for you. But we had some great progressions talking about why breathing is important, and what I really mean there is why breathing appropriately and correctly is important, and correctly being different scenarios require different things. Okay, and how we can integrate so many different things together to create so much benefit for us. And you can see, as I described in this podcast, how all those things start to come together to help each other. Now, it can be difficult to master these sort of things and get out of our patterns that we're currently in, but it's important, especially for any athletes or people who are searching for performance, whether that's just people that are working out in the gym, they have a full-time job, but they still have goals in the gym, or if they have goals on the golf course or on the pickleball courts, whatever it might be. And just for long-term health and longevity, like I said, lots of chronic pain comes from our breathing patterns. And if we can figure out ways to improve that, like I described in this podcast, we not only improve performance, but we improve our pain, longevity, discomfort levels, and we start to reduce them, and we get a whole lot better at the same time. Okay. So again, thanks for listening. There's more info regarding some of these topics we talked about in different blog articles, as well as that other podcast, my thoughts on low back pain, that you can check out to really dive more into more specific aspects of the different concepts we talked about today. All right. Thanks for listening.